Okay, so for someone who's got digestive issues, which I did have and I've been working through, I'm going to show you two maneuvers that are really amazing for that. The first one is the psoas maneuver, and this is working with not only the muscle of the psoas, but that muscle is surrounded by the connective tissue, the fascia, which runs through the intestines and the core of the body. So when we're working with this, we are effectively working with the small intestine, the ileocecal valve, which is the site of a lot of blocked digestive issues, and the large intestine. So the small intestine, the large intestine, and we're really opening up those areas, because if we've been sitting for prolonged time and we're suffering from any kind of dehydration, then that kind of sitting and compressing is really putting a lot of pressure and adhesion in this area, and this area gets very blocked. And so we're going to be opening up that area and working on both sides of the body. And this will be a strange sensation when you're digging into the area, the skin, and pulling it up, which is what we're going to do. You might feel like a burning sensation. It feels like you are kind of ripping the skin a little bit, but you're really just opening up all those adhesions. And we're going to be breathing through the mouth. So to start with, you will get your thumb, put it in your navel, and the other one on your right hip. And where the fingers meet in the middle is that point. We're connecting to the ileocecal valve. And you're going to be pressing in and pulling up. So you're standing hip width apart, and you're also connecting to the pelvic floor and engaging that. And we're going to pull in, pull up, and step back with the right leg. And you're going to lean all the way back, really lean into it. Feel the stretch down the leg, the hip, and the pulling up of the skin in this lower abdomen, and breathing through the mouth 6 times. You can lean into it more. If this is difficult with balance, you can always come down into the knee and pull back, and you can twist into the body more and twist out, really helping to open up that area. So also going to do it on the other side, getting to the Houston valve. So you also navel connection with the thumb onto the left hip, finding that middle point where the fingers meet, pressing in here and pulling up again to the skin, stepping back with the left leg, kind of bringing yourself down into the squat, pulling your head back, leaning back, and breathing through the mouth 6 times. Coming out. Now you can do that 1 to 2 times. It's really helpful. It's really opening up and letting energy and blood flow move through the intestines. Again, the core of the body is really helpful. If you're feeling bloated, you can do it after eating, constipated, any kind of digestive issue or dysfunction. It's really going to start to shift that, and you're going to have to you'll be able to have a bowel movement. You're going to feel a kind of a lightness and openness. Another one that I really like to do for digestive issues, which has been really helpful for me, and is also it's kind of an interesting one as well for sensations. It can feel uncomfortable, is the belly talk, because you're also going to be connecting to this artery that runs through, and you might feel the pulse of that blood vessel when you work. You're also going to feel the pressure that as you dig in. And also there's a lot of emotions stored here, a lot of energetics in the center of the body. The same with the psoas. The psoas, you're also going to feel emotional releases afterwards. This is where we hold a lot of fear. guilt and shame. And the stomach here also holds a lot of energy, energetics, emotions, and also we're giving the digestive system a rest from its rotation, its clockwise rotation, by working in anti-clockwise rotation. So we're going to start. You have to make sure also that your nails are not sharp, and that if you need to, you can put a cloth or something over your nails before using your nails to dig in. You're going to be going in with quite a pressure, like 80% pressure. And so it can feel really uncomfortable to begin with, and because you're meeting a lot of resistance. And this tightening of this area really pulls the core down and in. And so you're releasing that, you're giving the digestive system a rest, and you're helping to open up the body, which is going to give it a chance to get a lot more energy, a lot more clearing. It's really going to help with the digestive issues. So you can do it this way by kind of digging in and then twisting the thumb up. But I find that quite difficult, especially for quite a long time. And we really want to make the most of this by doing it for 3 minutes. So I've kind of do it a slightly different way so I can get a lot of pressure in and keep the rotation. So I use both fingers to dig into the area, with the left hand slightly higher and the right hand slightly lower, and then I move into the torque. So I'm twisting in that anti-clockwise, digging in, feeling that kind of pulse of the blood vessel, starting to breathe in and out through the mouth. You can see I've got this good torque, this twist on the belly button. Keep the pressure in, keep the rotation on. Nice, deep, slow breaths. Engage the pelvic floor. You can move around a little bit gently, but I find that can really make it difficult to hold the pressure and keep the rotation on. So just see what feels comfortable. The more you do this, the more you're opening up this space, and you'll get better at maintaining and holding. Try and release the shoulders down from working too hard. Relax into it. Done a minute now. And open up to the left side and the right side a little. If it feels comfortable, manageable. You can do this lying down. Rotating the body. On the second minute, going into the last minute, you might want to reconnect to the rotation, to the grip, to the pressure. If you have to stop and come back to it, you can do a minute and a half, rest, and come back and do another minute and a half. It's really amazing. You're going to feel so much lighter, such a release of energy. It's also going to loosen up the front of the body. That front line of the body is going to open up. It's going to help with your posture. Okay, we've done 3 minutes. Well done. Shake off the hands. Walk around. Let all those movements integrate with some walking. Release the shoulders anywhere you feel like you've been overworking. Just notice the sensations in your abdomen, how light and open it's starting to feel. You may feel emotional releases from doing both of those maneuvers because they are really connected to a lot of suppressed emotions as well. And you may feel that the bloating is going, that the digestive system is starting to move and open. It's really wonderful.